This year's theme of World Alzheimer's Day is never too early, never too late, which aims to underscore the pivotal role of identifying uh, risk factors and adopting proactive risk reduction measures to delay and even prevent the onset of disease. On to create more awareness about the disease, we welcome Dr. Vinay Goyal, Chairman, Neurology, Movement Disorder, Institute of Neurosciences, Medanta, on the session Early Detection Revolution Advances in Predicting Alzheimer's Before Symptoms Appear. Thank you so much, Dr. Vinay, for taking out your time. So we start with the first question here. Can you please explain us what Alzheimer's disease is, and why is it a significant concern in healthcare today?
See, Alzheimer disease is a type of dementia. When I say dementia, it means you are forgetting or your memory is going down. There are many causes of dementia, but Alzheimer is one of the cause which is degenerative. When I say degenerative, it means your memory is gradually going down and it is progressive, and the brain cells which are responsible for the memory are degenerating or they are dying. And in this condition, classically, patients have three, four symptoms. One, they start forgetting recent events. So what they had in the breakfast in the morning, what conversation they had with the family in the morning, what recently has happened, what was the festival yesterday, what did they do. Second problem is they start losing their way. So if the place which they've been going regularly for a long period of time, if they go now, they will not remember which is the road to the right place. Sometimes when they get up in the night, they sometimes forget which side is bathroom, which side is kitchen. Gradually, they start forgetting the name of the family members. In the worst circumstances, they do not recognize anybody and become very big problem. So this is how the Alzheimer is.
So the next question would be: there has been recent advancements in diagnosing Alzheimer's disease before symptoms appear. Could we have certain breakthroughs that are being done in this particular segment and their potential impact on early detection and treatment?
See, before you develop symptom of Alzheimer's, there is no point in diagnosing them. My joke is, if I can predict that you will have a fractured leg, would you like to have a plaster today? No, that's not a fair thing. Second thing, if you will not get a fracture, still you will be worried, mera fracture kab hoga. So predicting something is not a good idea. Some, especially people who have family history of Alzheimer. As you know, there is currently no cure for Alzheimer. So what we'll be doing will be changing the lifestyle. What is the change in the lifestyle? Do you mentally remain active? Do regular physical exercise. If you're diabetic, you control your diabetes. If you're hypertensive, control your blood pressure. Eat healthy, maintain your weight, maintain your blood pressure, and do a lot of mental activity. What is mental activity? Talk to the people. In morning they go to the garden and sit down after a walk and chat. Is excellent thing. Play cards. When I'm playing cards, I will have to think what are your cards. You have dropped one card. Why did you drop this card? So it's a mental exercise. Play Sudoku, play chess. So do arithmetic calculation. And talking to the people is a very important thing. I see a lot of people who develop subtle dementia. Nobody talks to them. And that is the worst thing. One more thing, people who have a doubt, first always check your hearing. Hearing is one of the worst things which can happen to a person who has a memory loss. Because their memory is low. If there is a hearing loss, he won't listen well. People will not talk to them. And so the communication is finished. So it's very important that they maintain their hearing. As far as diagnosis is concerned, we do CT scan, MRI, EEG, some blood test. That is basically to exclude other causes. I give an example. Somebody is a brain infection. So if you do some test, you will know, and it's treatable. Common thing is sodium will fall. You check sodium and you will be able to correct it. Thyroid is abnormal. You can correct it. Diabetes is severely uncontrolled. You can correct it. If all these tests, when you do, you exclude it, then you do some battery of tests, psychological tests, to look at which particular brain functions are affected. And then you conclude that the patient has Alzheimer's disease. Your question is, can we diagnose before develop symptom? We can diagnose. There are two ways of doing it. Either we do an amyloid PET. It's a new kind of a PET scan of the body, where you do a PET scan and you can look at the amyloid load in the brain. Now, which is also available in India, is we do CSF. CSF is a spinal cord fluid. You take it out and you look at the tau and amyloid level in that. That is also now available. But we do that when somebody has a clinical symptom, we suspect Alzheimer disease, and I want to be sure this is Alzheimer and nothing else. Then we do these tests. But somebody is healthy, somebody does not have any memory issue, there is no point in doing these tests.
So while we are discussing about the testing part, there have been a lot of myths associated to having Alzheimer's genetically. Keeping in
Yes.
mind, people have concerns that if their elders have it, is there a possibility of having the same in their future as well? So, what do you have as a point of opinion on this? Is Alzheimer's actually a genetic disease, or is there
Yes.
a way to find out that if there is a possibility of having a genetic Alzheimer's disease, how can one understand and prevent, like detect it at a very early stage?
Yeah, sometimes the family Alzheimer runs in family, and we know there are some pre-signaling one, pre-signaling two particular type of genes which are responsible for it, but they usually cause dementia very early in the age. Somebody developing dementia in the third, fourth decade, fifth decade, so early when they are young, then I would do all these tests. But somebody developing dementia at the age of 65, 70 years, 80 years, then I would not do all these tests because they are age-related changes. So the role of genetics is more of a research rather than for diagnosing these Alzheimer patients.
So while you had touched base a very important topic of support, because obviously while if someone is going through that entire period of losing their memory, the person needs a lot of support. So what kind of support can the friends, the caregivers, and the immediate family members should ideally give to those people so that they can, even after having Alzheimer's at a younger age, they are able to lead a relatively healthy and a happy life till the time the disease worsens.
See, you have to understand that Alzheimer is a progressive disease. So the problems are going to increase with time. The memory is going to be low. There will be time they may forget the family members. And I see the commonest people they remember is caregiver, and not their son or daughter or wife or husband or children, because they are not that closely associated with the family, with the patient. The important part is we have to understand that, it's like small 2-year-old child. He will ask you 5 times, will do mistakes. You don't have to get annoyed about it. Child is going to grow and his symptoms are going to decrease, where here this child is going to worsen and problems are going to increase. So sometime when they will ask you three things, something 3, 4 times, you get irritated. You don't get irritated when your 2-year-old child is asking the same question. When he's spoiling the clothes, you get irritated. You don't do that with 2-year-old child. So now it's like a second childhood. So we have to be very, very compassionate. Second thing, I always tell my patient, never fight with them. If you fight with them, it's a disaster because they won't listen to you now. They will be more stubborn. They stop eating. They don't follow a command, and they don't believe in you, and that's very bad. So always gain their confidence. Make them feel that you are there to help. Don't get irritated. If he is irritated, let him be. Sometimes it becomes a behavior issue. They have a lot of behavior problems. Don't talk to your doctor. We can give always medication to reduce their behavior issues, which can be very well controlled. Dementia may not be able to control, but behavior issues we can always control and improve the quality of. Other thing we need to do is about diet. They will not have enough judgment how much to eat and what to eat. So you need to make a fixed diet that this much amount of a diet has to be given. Toileting. Best thing is to toilet them like a child. So take them to bathroom every 2 hours. Whether they void or not is not important. So that they will be in habit of going to bathroom. So you have to cultivate that. Like we train a 2-year-old child. Then sleep. Don't let them sleep in the day. What happens? Everybody is busy, they are sleeping in the day. When everybody wants to sleep, they are awake in the night. When they are awake at night, the biggest problem is they walk around, they fall and cause serious problem. I say every fall is dangerous. Either you break your head, you may not survive. You may break your leg or hip joint. It is you get bedbound, then you get infections and a lot of other problems. So if we look into all these things, we have to think that we have to make everything possible that they are safe. Because they lose the we lose the weight, or is very important. The doors are locked all the time. If you are traveling, never leave them for even for a minute. Worst circumstance, if you're sitting on a station and you say, I'm just coming back. Within 5 minutes, he'll get panic where I am and why I am here. He would not remember it. Worst circumstances, imagine there is a train standing there, he boards that train, thinking that we are going somewhere. What will happen? You might lose that person forever. I have very bad stories, which I don't want to mention here. But point is, so every other thing, always give a tag which has number, phone number, address, one. I always say with ID you can hang a cheap mobile which can only dial. Now point is, even if you dial, he will not pick up. So make practice every day. Dial from the other room, ask them to talk to you. If they can dial you back, nothing like that. So in case they feel alone, make him practice कि बाहर जाके आप मेरे को कॉल करो. So वो कॉल करेंगे, कॉल करने की आदत बनी रहेगी. तो ये छोटी छोटी बातों का बहुत जरूरी ध्यान रखना है.
With the intensiveness that I am able to get through while I'm talking to you about the disease. So I think it's something that even as care we are able to understand how much care that needs to be given to these patients, even though it's something that eventually will cause a memory loss. But I think it's another whole new journey for the entire family to go through. That's something
So
that you're able to highlight.
that is also called caregiver burden.
Hmm.
It's not very easy to handle them.
Hmm.
Most of the time, the patients are in their 60s and 70s.
Hmm.
Their spouse is also of the same age. Other family member thinks that she or he will do everything, which is not fair. Because after some time, that person gets exhausted. And this is how the patient suffers now. The spouse cannot do everything. She can get up 5 times in the night and take him to the bathroom. So best thing is to give diaper. Just now I was talking to somebody, he said, no, he will not use diaper. You have to make them understand. If you don't use diaper, you will go to the bathroom, you will fall down, you will have fracture. That's disaster. So best is to use diaper. Train them also. For bladder, you don't drink water in the night, so you don't go to void again and again. So there are a lot of other things which has to be taught in every patient.
That is true, sir. And while we're touch basing the aspect where testing, though is available across, there have been issues that we talk about advancements in tier 2, tier 3 cities as well. Keeping in mind, not many people are aware that if they have Alzheimer's or that there's a possibility of having Alzheimer's, they have certain tests that are available. So, how do you think the hospitals as an institution or the professionals, the healthcare professionals as individuals, play a crucial role in creating that accessibility and the awareness perspective in tier 2, tier 3, and remote areas?
Yeah, as far as diagnosis is concerned, that's not a big issue. Any physician or doctor can make a diagnosis. We don't want to confirm it genetically, or we don't want to do CSO, PET scan. That's required sometimes when there is a doubt. Second thing, what basic care requires, medicines are also very well known. Those standard medicine which we use, everybody knows about it. Point is, they don't work well. Initially, they show some improvement or some benefit. After some time, they don't work. Now there are newer molecules like aducanumab, lecanemab. There are monoclonal antibodies which have come. But problem with them is they are very, very expensive. I don't know, maybe goes into lakhs. Second thing, their efficacy is not proven. Only they have shown that I was talking to you about CSF amyloid protein, which goes down if you give treatment. But the efficacy of the drug is yet to be proven. So these are accelerated approval which America will give, so that it can be tried in patients. That's the idea. So currently speaking, modification of lifestyle, taking care about their behavior, food, toileting, clothing, sleep, their entertainment, keep them busy. These are more important aspects than oral medications.
That is true, sir. That is true. So, moving forward, sir, in the context of early detection and management of Alzheimer's disease, what advice do you recommend for individuals who may be concerned about their own cognitive health and want to take proactive steps in ensuring that they are able to prevent the issue of Alzheimer's at an early stage itself, or even at, is there a possibility that they can even reverse the earliest signs of Alzheimer's only via their lifestyle changes?
What we say, brain is something like use it or lose it. So more you use, more it is retained. So some older people, they used to talk a lot. चौराहे पे बैठ के, गार्डन में बैठ के घंटों बातें करते थे, अपनी वही कहानियां चार चार दस दस बार सुनाते रहते थे, और आर्गुमेंट होते थे, बे सिर पैर के आर्गुमेंट हो रहे हैं, पूरी दुनिया के बारे में आर्गुमेंट हो रहे हैं, जो उसका वो कुछ कर नहीं सकते. तो दिस वर मेंटल एक्सरसाइजेस. नाउ बिकॉज ऑफ द मेटेरियलिस्टिक, बट वी डोंट हैव टाइम, वी ऑल आर बिजी. So, I'm sure we all can look around the elderly people who are in the house. Nobody has the time to talk to them. In cities, it is impossible for them to have an access to nearest garden, because कौन लेके जाएगा उनको? तो they practically get housebound. तो मुझे लगता है कि ओल्ड एज में अर्बन सिटी बहुत बढ़िया नहीं है, रूरल सिटी में ये बहुत बड़ा फायदा है कि कोई ना कोई आपसे हर समय बात करने के लिए बैठा है. लोग ही आपस में इतना बात कर लेते हैं, हर छोटी बात पे बैठ के बात कर रहे हैं, 2 घंटे बात कर रहे हैं. टाइम है तो अच्छी बात हो. तो बात करना बहुत जरूरी है, डिस्कशन करना है. तो फैमिली टीवी देख रही है तो उनको पूछो ये टीवी में क्या चल रहा है, कौन सा सीरियल है, अभी पिछले एपिसोड में क्या हुआ था, अभी 5 मिनट पहले क्या हुआ, बताओ जरा. या उनको री एम्फेसाइज करो. जो भी मिलता हूँ वो बताए, मेरा नाम ये है, मैं आपसे उस दिन मिला था, मैंने आपसे ये बात करी थी. तो हर चीज को रिवाइज 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 करना पड़ेगा, जिससे उनको ये महसूस नहीं हो कि मुझे याद नहीं है. डोंट मेक देम गिल्ट कि आपको तो याद ही नहीं है. दिस इज वेरी बैड. नेवर मेक देम रियलाइज कि आप भूलने लगे हो या याद नहीं है. इज वेरी डेरोगेटरी फॉर एनी पर्सन विद लिटिल रेस्पेक्ट. ही विल नॉट टॉक टू यू अगेन. जैसे कि मेरे को याद तो है नहीं, फिर ये कहेगा मुझे याद नहीं है. तो बहुत कंपेशनेट हो गया ऐसे बात. आपको पता है उनको याद नहीं है, तो उसको रियलाइज कराने का क्या जरूरत है. वाई वॉन्ट टू रियलाइज देम कि ये ऐसा कर लें. तो अगर जो लेकिन आप बजाय इसके कि आप खुद ही बताते हैं कि देखिए मैंने आपसे ये बताया था ना उस दिन, तो वही उसी बारे में बात कर रहे थे, या मैंने बताया था मेरा नाम ये है, मैं ये करता हूँ, मैं आपसे परसों मिला था. तो वो कहेंगे अच्छा ठीक है. उनको गिल्ट नहीं दे रहे हो आप, तो आप उनको अपनी बात बता रहे हैं. उनके पर्सपेक्टिव से सोचिए तो बड़ा अच्छा रहेगा. तो वो आपसे बात करना भी चाहेंगे फिर, कि ये आदमी आता है, ये मुझसे बात करता है. ये बहुत जरूरी है. घर में जो सर्वेंट है उनको भी इस बात की आदत डालनी चाहिए, इनसे बात करिए और रिस्पेक्टफुली बात करिए. I hear horror stories when they're mistreating these patients. There's nobody looking after. We can't discuss it here, but if you have a servant, put a video camera in the room and watch it all the time, that how he's been treated when you are not there. वो भी बहुत जरूरी है. And we hear all the stories in newspapers and televisions.
That's true, sir. While we are talking about the issue of issue where there may be behavioral changes, do you think taking an external help to help seeking for counseling for these patients who are having Alzheimer's disease to ensure that they don't go into depression, because keeping in mind that obviously they are going through that entire process, that obviously they are losing their entire set of memories. उनके लिए क्या
See,
आप सजेस्ट करते हैं कि होना चाहिए नहीं होना चाहिए?
हमारा इंडियन सोसाइटी का स्ट्रक्चर बहुत बढ़िया है. ये सारी बातें जो होती है ना, डिप्रेशन वाली, लोनली वाली, ये दूसरे देशों में ज्यादा होती है. हमारे यहाँ तो परिवार की तरह रहते हैं, और जो भी जॉइंट फैमिली होती है उसमें 20 लोग होते हैं. तो आदमी अकेला तो होता ही नहीं कभी, सब एक दूसरे से बात करते हैं. अब ये मॉडर्नाइजेशन का साइड इफेक्ट ये कि हम न्यूक्लियर हो गए। बच्चे और बहू दोनों पर काम पे चले गए, पिताजी और माताजी अकेले रह गए। और ज्वाइंट परिवार में तो ऐसे पिताजी माताजी 10 हैं, तो वो खुद ही अपना काम करते हैं, बिजी रहते हैं। हजार बातें होती हैं, हजार चीजें होती हैं। तो ये जो पुराना हमारा सिस्टम था उसके बहुत बड़े एडवांटेजेस थे। और अभी भी मैं इस बात को देखता हूँ कि इंडिया में पेरेंट्स की बहुत ज्यादा केयर होती है, उनकी हर छोटी बात का ध्यान रखा जाता है, कि हमारा सिस्टम ऐसा है। पर ये अब ये भी देखता हूँ मैं कि धीरे धीरे इंस्टीट्यूशंस आ गए हैं जहाँ पे ओल्ड एज में उनको छोड़ जाते हैं, और फिर तो जो होता है ठीक है।
That's something that's, I think, that's senior care part is something that's always, I feel, is a totally ball game altogether, because obviously keeping in mind they need more amount of care, and with the fast paced environment at times the kids want their parents to have the best of resources that are available. So my one last thing would be to ask you out, what would be your message for the World Alzheimer's Day? Because we have been touching about early detection. We have been touch basing the aspects where people want to go for a change within their lifestyle to prevent the early detection. What do you seek as your message for this particular day? What would be your
See,
message?
the best message for Alzheimer's disease is because India is now growing. The elder population is gradually increasing. And shortly, I think within 20 years, India will have largest number of people with higher age. So our burden of these people will increase. So government has to think from that point of view, that we have a place where they can be taken care of. Medical institution has to take care of it. So society has to learn. If there is a society, then it should be must to have a community hall, and they all these people can go every day, meet and talk and play cards and play chess and read newspaper, listen to the television and discuss among each other the old gossip which they used to do. That is an excellent exercise. And they can invite experts. Somebody can come about income, can talk about income tax, other person can talk about health, somebody can talk about hobby. So keeping them engaged. So it's not only doctors have to do the big role. I think the society has to play a big role. I remember I had gone to one society in Udaipur that is called I just forgot the name. There is a gentleman who has created a room that is called Muskan Club, and this room is any elderly person can come, sit there, read newspaper, play cards, play chess, watch television, and they also give one cup of complimentary tea, which is good enough. A lot of people bring their food. They share the food with each other, and they spend 4 5 hours there and go back home in the evening. This I've never heard this kind of facility anywhere. So those who are well-to-do in the society, if they can give it back to the society like this, and this is, I think, excellent gift to the society. They are not charging anything. They're making sure that they are comfortable. I happened to go and give a talk there. So somebody invited me. So I gave a talk, health talk. I spoke almost 45 minutes. They asked me a lot of questions. So this kind of activity has to be done by society. Even places of religion can play a big role. I all tell all my elderly people, whatever is your faith, if you are Hindu, you go to temple, morning सुबह शाम आरती होती है, जाइए, दोनों टाइम जाइए, वहां 10 लोग मिलेंगे, बात करेंगे, आरती बोलेंगे, आपकी स्पीच की एक्सरसाइज हो जाएगी। वॉक करके जाएंगे तो आपकी एक्सरसाइज, वॉकिंग एक्सरसाइज हो जाएगी। और क्योंकि ये टाइम से होता है तो आपको टाइम से ही जाना पड़ेगा, तो आपका लाइफ एक डिसिप्लिन हो जाएगा। तो ये छोटी छोटी चीजें हैं जो हमारी सोसाइटी में ऑलरेडी थी, उनको रीस्टार्ट करना है, थोड़ा सा मोबिलाइज करना है। ठीक है जी।
Thank you. Thank you so much, sir, for your precious time. And I do hope that via our conversation, we are able to bring out the impact that uh, Alzheimer's disease creates, and the major thing what the patients who are suffering from Alzheimer's need. Thank you so much, sir, for your time, and we hope to create more awareness about the subject in the later future as well.